We've been working with customers using high street technology to support people to live independent lives and integrating those items of technology into people's care plans, probably for around the last 4 years or so. And I think with every customer that we work with, we identify a new way of using some of that technology. But sometimes it's quite difficult to envisage that if you haven't actually seen it operating in your own home. And equally in the Smart House, we're also looking at some of that physical accessibility to essential facilities in your home. And again, it's quite difficult to picture some of that. So the team had the idea of bringing all of that together in one property, in a domestic dwelling, so that we could really start to see what that might look like in someone's home and also how to work with it. The idea came from the team and they've done all of the work around this, but we've been inspired by our customers and some of their stories to bring this property to life. The idea of this project is twofold. So we've started in the first instance by creating the physical Smart House, and obviously, we're delighted that we've brought this to the place that we're now at, where we can open it and start to use it.
So we've got a range of smart technology as well as some of our digital telecare solution in place. It's the most up-to-date equipment that's available on the market. Stuff like smart lighting, smart heating controls, blinds, curtains, trying to see what the art of the possible is to give people the most amount of independence in their own home, as well as having that security element with stuff like the door locks, the smart security system, your telecare solution, your traditional care alarm, but of a modern era, that sort of thing.
We've also made it so it's holistic. It doesn't just focus on your needs, it focuses on your overall health and well-being. So there's stuff like a Nintendo Switch in just for a bit of fun, but you've also got your sensory lights, which can provide a calming effect. So it's just basically a house filled with anything and everything that we could think of that would help.
So I think the house will be used in collaboration with colleagues from therapies, so the health team and academics to come in and try new things. We're probably also going to use it for training teams within Sunderland Care and Support and Sunderland City Council on how to use a smart tech and bring customers in to help them use technology in the future. We designed the Smart House in collaboration with health, occupational therapists, the management team and SCAS, and within the tech team. We looked at what was needed in the city and what technology was available and some of the demands in the city. And then we came together as a group and decided what technology we were going to use. And I think it was important as well from the outset that we made it as real as possible, so we wanted it to be like a real home. And so the technology we've used is what's available on the market, because when customers were coming in, we wanted them to be able to buy it themselves or have it provided easily. We didn't want things that were totally bespoke and were really hard to get a hold of.
If we want our workforce to be able to use assistive technology, the only way that we can do that is actually that hands-on learning, isn't it? And I think to work collaboratively, like Chris has mentioned before, it's really nice to have this one site in the city where we can work with, as Chris mentioned, our health partners, our students at the university, the lecturers at the university who are teaching those students. So it's great to have this space here that we can work together and learn together. So Chris has obviously got his tech specialists. My team are the therapists that are working in there. So I think naturally our therapists are going to your team asking, we have a customer, we have this difficulty, is there anything out there in your team? And they're horizon scanning all the time, aren't they? And they have that collaborative working, which means that we can continue to monitor and look, and I know you'll be able to look at putting stuff in the house, wouldn't we, as times change?
Yeah, I think as Lindsay says, it's constantly horizon scanning, seeing what's becoming available and what we're going to be able to deploy, not just here, but in people's homes. So obviously connectivity is one of the things we would have to look at when we're looking at new devices, and also it's got to meet certain standards, so we have to assess technology before it comes in. But this is the perfect space to try new technology, because if we get something wrong, it doesn't matter and we can learn from it. And I think in terms of developing going forward, we're probably going to be looking at how we can make this dementia friendly, to bring people in with dementia and make it a little bit more accessible for them to use.
We work collaboratively across all partner agencies in Sunderland, and with one of the main agendas being about ageing well. And that may be about falls prevention, falls awareness, that might be about healthy healthy living, but also it's about empowering people to be as independent as possible for as long as possible. And I think a lot of people have technology in their homes now, but they don't necessarily know how they could best use it for them. So I think we're here as a service to empower those people to age well.
I think it's really important that the house is accessible not just for older people and vulnerable people, but for children as well. And I think sometimes we miss that, in that we don't always support children in the way that they need to be supported with technology. We presume because the kids that they can use technology, and where sometimes they can, sometimes technology isn't accessible for children as well. So some of the work the team will be doing is so simple things like playing on an Xbox. The team have worked with people to look how we can adapt controllers for people to access gaming, because it is important for kids to be kids.
I think it's really nice as well, because I think one of the biggest things that we do when we're working with children is the routine, isn't it?
Yeah.
So you might have the occupational therapist know that a child's struggling with the routine, that's affecting things at home, or the child's got disabilities and is requires on equipment or parents to move them from A to B. And actually we found that installing some assistive technology so that child can manage their blinds or call for mum and dad, or has had a massive impact, not just on the child's ability to manage that, but the child's well-being and safety. So I think that's great. It's another great place for us to work.
Things don't always go to plan, but we always work through them, and that we can use the tech in various ways that we didn't actually think possible. The amount of things that we can voice control is amazing. We've got the lift that we can use our voice to control, which I never thought was ever be possible. It's kind of embracing the traditional occupational therapy with the smart side of things, where it's something you could never thought was possible, basically. So just waiting through that challenge and learning from that kind of thing's been a great part of the process, I think.
Yeah, the technology is ever developing, so it's kind of a challenge for us to keep on top of it, to know specific quirks of each bit of kit, know how it functions together, all as a whole, trying to match it all. That's been quite challenging.
It's just been amazing to see how it's come from essentially a shell to now a fully functioning assessment home, which can be used for training, place just to demonstrate what is available for our customers, and just seeing how well that actually has come together has just been amazing from my side of things.
Yeah, demonstrating it in a real and home environment is like a total strength to us. Normally testing it in an office environment is quite clinical, but then in an actual home you can see how people would use it. And not only that, we can kind of demonstrate that to the therapists, the healthcare professionals and the clients, not just giving them a description of what it is, they can actually see it in action and physically use it. So it's just easier to actually explain and to show people.
The second phase of this project is to recreate our physical smart house in a virtual world. So what we'll be looking to create is a platform that showcases the property, where we're able to see the technology in it and some of the devices and accessibility around the home. And for customers, for colleagues, professionals, to be able to drill down and understand how some of the technology works and how to then apply it in their own home. We're really hoping that we'll be able to use the virtual smart house to communicate directly with our customers, to keep everybody informed about new developments in assistive technology, and also to interact directly with our customers. The Smart House has a real part to play in our plans around health and social care, particularly with a smart cities perspective. In this city, we recognise that the opportunities, the innovation that comes along, we want everybody to be able to access that, and we say that nobody should be left behind. We really want to use this Smart House to demonstrate how we can apply this way of working and work with anybody, so that everybody has that access of opportunity and can really understand how tech can integrate into their lives to support that independence.